administered? Does it work? What difference will 10 days make? And do you buy the apparent science behind the change to 10 days? You can text 84850, tweet at LBC, and call me on 0345 6060973. We welcome back to the programme Dr. Bharat Pankania, Senior Clinical Lecturer in Public Health Medicine at Exeter Medical School. It's good to see you, and that's a lovely tree, if I may say so.
Thank you, Eddie. Thank you. Good afternoon.
Good afternoon to you. Have you had to self-isolate during any of this?
No, but I've been so busy that I've not been out and about, and hence I've been lucky.
The change to 10 days, we heard a little earlier from Dr. Jenny Harries, if I can paraphrase. She said this was based on a continuous accumulation of evidence. She mentioned several bodies which were involved in this. She said the tail end of infectiousness is the time you're least likely to infect others, and this decision to cut to 10 days is a sort of reasonable balance. What say you?
I think we are mixing up infectiousness with quarantine period. So what Jenny Harris is clearly referring to is the quarantine period, which has been 14 days. And yes, if you're referring to the quarantine period, then the majority of people become infected and infectious around day 3 to 5. And then very few of them will go on to, at the first sign, become infected at day 10 and onwards. So what you're doing is a reasonable measure to say small percentage will go to become negative to positive after day 10. Fair enough. So what we have to do is say, okay, 10-day may be a good compromise, provided we make sure we get the messaging right, which is your quarantine period is 10 days, your infectious period is also 10 days. However, if you come out of quarantine on day 10, you need to do a checklist. Have I got any signs and symptoms? Have I got any loss of smell and taste? Have I got anything that I need to be concerned about? And if so, you still need to continue to isolate because you've now become a case.
Well, you see, that's interesting. I suspect if I was self-isolating for 10 days, once the 10 days was up, I'd simply say, hooray, freedom.
Indeed. And this is why getting these messages right is so important. And even when Deputy Chief Medical Officer Jenny Harris said the period of infectiousness diminishes after 10 days, she is mixing up infected case with quarantine. And it is the quarantine that is reduced from 14 to 10.
You're sort of saying, you're far too polite a man to say this, but you seem to be saying that Jenny Harris is, with the best will in the world, getting mixed up. She on this critical messaging, is confusing us.
I agree with you, Eddie. And, the clear messaging is we are reducing the quarantine period from 14 days to 10 days because we feel after the 10th day, very few people will go on to become a case.
I want to ask you, while we have you on, Dr. Pankania, about one of the announcements last night in the Downing Street briefing about mass school testing for parts of the southeast of England. What do you think?
It's a big concern to us because a negative test is meaningless because the tests are not very accurate and self-administered tests are even less accurate. And therefore, if you have an accuracy result of about 50%, then in 50 to 60% of events, you will be getting a false negative. And you could again be giving false messages about you are negative, therefore you are okay. When actually the correct message should be, whilst you have been tested negative, you need to continue to practice scrupulous infection control because our tests are not that accurate. You need to say it. Our tests are not so accurate. We're doing our best. And the other thing that is also very worrying, just like we've had the centralized testing, the centralized contact tracing, I hear the government is setting up new private out of the NHS laboratories to do these tests. And I'm saying, what's wrong with using our own National Health Service labs and invest in them to increase their capacity? Because then they become an asset to the nation.
Thank you for talking to us, as ever.
Thank you.
Dr. Bharat Pankania, Senior Clinical Lecturer.
Bharat, thanks so much for joining us. We really appreciate that.
Thank you. Pleasure.
All the best. Enjoy your evening.
Thank you.
On this reduction to 10 days,